We intend to use a system for our electronic medication chart, MedChart, as well as our electronic patient notes. So it allows the nurses and doctors to go in and make notes, but it also allows them to administer and prescribe medications and review medications by pharmacists. Our primary users for the bedside devices will be pharmacists, pharmacy technicians and nurses. And we plan to pilot this on 2 of our renal wards in the coming weeks. I think the major benefit is the fact that the care is brought to the patient's bedside. I think the fact that we're next to the patient and interacting with them has a massive effect on their care and improving adherence for the patient as well. I think there's a time-saving benefit. I think the fact that having the chart by the patient's bedside also helps with saving time in terms of losing drug charts and trying to find a paper drug chart in particular. I think also there is a cost-saving benefit in terms of the fact that we don't have paper anymore, and we'll be hopefully moving towards a paperless NHS by 2018. One of the major benefits will be patient engagement and having the chart at the patient's bedside, allowing them to interact with the chart and also have an influence in their own care. I can access the system by using my NHS smart card, which I pop into the actual device itself. I log on using my passcode, and this brings up a terminal server farm which allows me to go into the patient's record itself. I can bring up the record and I can show this to the patient and ask them any particular medication related questions. I can, for example, ask them if they're in any pain and thus administer the particular pain meds that they want administered for their own care. The clinical staff have been very, very helpful and very interested in using these particular systems. They find that using it at the patient's bedside is a benefit to everyone. The patient can actually see what they're taking and they can engage in their own care, which is very important to improve patient adherence. So the device is actually secured to the wall, so you don't have to worry about carrying around your own iPad or your own tablet device. And you can actually access everything at the patient's bedside, as I say.
Before we started the project, we had a small patient engagement event where we engaged with the patients and asked them what they thought about the use of Hospedia by the bed. They were very positive about the use of it and really liked the idea of actually being able to see their patient's chart or their notes and engaging with the nurses or doctors. Now, we're starting a pilot on our 2 renal wards, and what we will do post-pilot is actually do a real-time patient feedback form for our patients to see what they think and feel before we move on to the rest of the wards. The Guy's and St Thomas's IT strategy is to create a digital healthcare system and digital culture. It has a number of components, moving to paper-light operations, creating an infrastructure that is both highly performant and resilient, and providing access on the move within and outside the walls of the hospital estate. This will give Guy's and St Thomas's clinical staff the ability to access patient information at the right time, in the right place, and in the correct format in the context of why it has been requested. In order to achieve this, within the wards, access must always be available and the bedside terminals in their latest version and be provided in an efficient and cost-effective way. In the future, the bedside terminals will be part of a mixed access layer that will also include tablets, smartphones, workstation on wheels, digital pen and digital dictation or translation devices. Any systems required for patient care whilst they are in the ward will be made available through the bedside terminals, and it is envisaged that the clinical and patients' apps will be developed specifically for bedside use.